Dental emergencies can be frightening, especially when they involve your child. Knowing how to handle these situations can make all the difference in ensuring your child receives the necessary care and treatment promptly. In this video, we will discuss what steps you should take in case of a dental emergency involving your child. 1. Stay calm. The first and most important thing to do in a dental emergency is to stay calm. Your child will look to you for reassurance, and being calm will help to keep them calm as well. Take a deep breath and assess the situation before taking any action. 2. Assess the situation. Before rushing to the dentist, assess the situation to determine the severity of the emergency. Is your child in pain? Is there bleeding? Is a tooth knocked out or broken? Understanding the extent of the injury will help you determine the best course of action. 3. Stop any bleeding. If your child is bleeding, use a clean cloth or gauze to apply gentle pressure to the affected area. Keep the pressure on for a few minutes until the bleeding stops. If the bleeding does not stop or is excessive, seek medical attention immediately. 4. Save the tooth. If your child's tooth is knocked out, try to save the tooth if possible. Pick up the tooth by the crown, the top part of the tooth, and avoid touching the root. Rinse the tooth gently with water, being careful not to scrub it. If possible, try to reinsert the tooth back into the socket and hold it in place until you can get to the dentist. If you cannot reinsert the tooth, place it in a container of milk or a tooth preservation kit and take it with you to the dentist. 5. Manage pain. If your child is in pain, you can give them over-the-counter pain medication like acetaminophen or ibuprofen to help alleviate their discomfort. Make sure to follow the dosing instructions on the packaging and consult with your child's dentist if you have any concerns. 6. Call the dentist. Once you have assessed the situation and taken the necessary steps to manage the emergency, call your child's dentist immediately. Describe the situation to the receptionist and ask for instructions on what to do next. The dentist may recommend coming in for an emergency appointment or provide guidance on how to care for your child until they can be seen. 7. Preventing dental emergencies. While it's important to know how to handle a dental emergency, it's even better to prevent them from happening in the first place. Encourage your child to practice good oral hygiene by brushing and flossing regularly, and schedule regular dental checkups to catch any potential issues before they become emergencies. Knowing how to handle a dental emergency involving your child is crucial for their oral health and overall well-being. By staying calm, assessing the situation, stopping any bleeding, saving the tooth if necessary, managing pain, calling the dentist, and preventing future emergencies, you can ensure that your child receives the care and treatment they need in a timely manner. Remember, it's always better to be prepared for emergencies than to panic when they arise.